Welcome back to Talk 1260 KTRC. This is Dr. Daniel Ronel. I'm here with my wife Betsy. We're talking about the humanity behind the vanity, the realities behind plastic surgery. We just talked about. Okay, go ahead.
We just wrapped up celebrity gossip about plastic surgery, which is always amusing.
Mm-hmm.
Now we're moving on to your
emails,
listener emails.
These are always interesting to me because this is what's going on right now. This is what I'm seeing in my practice.
Right, and this is what's coming from you, the listener.
Right.
And thank you for listening.
Thank you.
And also, you'll see us on 2 buses now.
Right.
Which is cool.
Right.
The show is being advertised on 2
Mm-hmm.
buses, so that's awesome. The back of one and I guess the
Side of
side of
another.
another.
Yep.
Yeah, so it's kind of weird to see our big heads on the bus, but it's being done. Okay. All right, first one. My son is 17 and has had acne scars on his face. He took Accutane a couple of years ago and no longer gets pimples. Can you help him? This is very common.
Yeah, it's very common. Acne scars are difficult. If they're really deep, then they can be cut out. That's where I would come in, and that's an office procedure. If they're moderately deep, I can put a filler in. The reason that they're deep is that the skin is tethered to the underlying structures in the face, and by putting in a filler, you can break up that tether and sort of lift the skin back up. It usually requires more than one treatment. But as importantly is also to treat the overlying skin to try to make it more healthy and thinner, and that's where the laser and microdermabrasion work excellently well. And Marion Urban in my office is really an acne expert, and that's where she can do. I had an office person, Lizzie, who's in California now. She's really significantly bad acne. Yeah, she's about 17. Yeah, she had
I
bad
never
acne.
noticed. She was very pretty, fresh-faced.
Marion really treated her well. So that's the thing to do. Yes, you can treat that. Accutane is a fantastic drug. It's very powerful.
Yeah.
You can't take it if you're going to be pregnant, but
must be hard to take out here too, because you're supposed to stay out of the sun.
Right. It's a great treatment because it basically stops the process which causes acne, but it doesn't help the scars.
Scars.
So, yeah, and some people develop keloids in acne scars, and those are particularly difficult to treat. You have to treat them with steroids and sometimes radiation. So that is the story with acne.
What about the kinds of acne scars where it's sort of like a hole?
Yeah.
Where the whole face is sort of mottled looking, and they've got these holes. It looks like a pin was stuck in them.
Cystic acne.
What do you do with those?
Those are difficult to treat.
I see that mostly on men.
Yeah, it's a combination of excision and fillers and resurfacing lasers.
Yeah, because their skin looks really thick too.
Yeah, and you can't turn them into a smooth mannequin, but it can improve
it. Right.
Yeah.
Nothing's perfect. I mean, just plastic surgery and all in dermatology is for an improvement, not a 100% change. It doesn't exist usually.
Right. And then finally, the last thing to say is in a teenager especially, it has a very important social implications to try to improve their face. So even treatments just to decrease the anger of the skin and the pustule formation, all that will really help.
But now, if the child is 17 and he has acne scars, do those go away as he matures and stops getting pimples?
They change. They won't go away. But no scars ever goes away. But they do change, and they might thin out.
Yeah. See, if that were my child, depending on how severe it was, I might say, wait. Just wait.
Right. Well, his mother has reached out to me on the internet, so something's bothering him. So,
oh, absolutely.
Right,
It will bother me too.
He's probably past the point where he doesn't want to do anything.
Right. Oh, that's it. It's funny. I just don't. We're in the beauty business, and I'm totally, into making myself better looking. But I don't really judge people on their appearance unless they're mean. If you're mean, then I'll rip you apart. But if you're normal and reasonable human being, I don't even see it.
You look at the inside.
Yeah, I see because that's what everyone sees. You don't see. That's why you can be flawless, but the nastiest, most miserable person. No one's going to see how beautiful you are. They're going to see how ugly you are on the inside. And the person, so I get it. I've never had bad acne, but it's funny. The other day I saw a man who was talking to me, and he clearly was very uncomfortable about his skin.
Yeah.
And he was the sweetest man. I didn't even notice his skin, but I guess I was picking up on his vibe, and you know, he was feeling naturally very self-conscious. And I tried to send a vibe back by saying, I didn't even notice until you pointed it out.
Okay.
And he had those, you know, holes in his face kind of acne. I didn't even notice because I was looking into his eyes. We were not romantically involved, if that's what you're thinking. Although I am a bored housewife. I'm just kidding. I got my sexy doctor. It's okay, don't worry. You know, I was looking at his eyes and listening to what he was saying. He was talking about plants, and he was so smart and knowledgeable about plants, and the gentle way he talked about plants. It was just so wonderful to hear. I didn't even notice his skin until he pointed it out subconsciously to me. So I get it, but
Okay.
you know, I feel bad. It's hard.
Yeah.
Anyway, all right. So that's it. Fillers, scar removal, come in to visit.
Laser.
Email on the internet,
Microdermabrasion.
laser,
Right.
microdermabrasion, and it will not 100% change things, but it will greatly improve. Exactly. Okay, next. I had a baby 10 months ago. I'm looking to get my stomach fixed. I have stretch marks and they seem not to go away. I've been working out, trying the lotions, but they're still there.
Yeah.
My stomach also doesn't go down. Oh, I know what she means. Can you please send me information, etc., etc., etc.
What does she mean?
10 months ago, well, that baby belly should be gone. But my assumption...
Some people keep it.
Yeah, I know, right. And it doesn't mean that you're fat. It just means your muscles are sticking out. And despite the working out, you know,
Yeah. I did a case today, a 22-year-old who just had a very, very, very large pregnancy in her abdomen, just right.
Yeah.
And so she had a cannonball.
Alright, so
Anyway,
here, this lady
the
wants
thing
to go to
about
stretch marks.
Yeah, the thing about stretch marks is there is no cream. There's no
Even
ointment.
Dr.
There's
Oz, I
nothing
was shocked,
that
recommended
works.
cocoa butter. I was like, Dr. Oz,
Okay.
come
But
on!
what he's saying is
And
that
the woman
that
showed her
Resveratrol-
stretch marks on his show, and they were rough.
Okay. Yeah, there's nothing. There's very expensive advertising for
Yeah.
you know, products that can help and cure stretch marks, but nothing really works.
What about laser?
Using laser, no.
Really?
It can help. Laser and all the other things that are advertised can help the quality of the skin, and that will improve the look of the stretch marks. If the skin on which a stretch mark is healthy, the stretch mark won't look as bad.
And scar creams.
But no, they don't make them go away. The only thing you can do is excise them.
Cut them out.
And, right, that's where the tummy tuck comes in. It removes all the stretch marks below the belly button, and the ones right above the belly button get pulled all the way down.
They're tighter.
Well, no, they get pulled down to where the bikini line is.
Oh, I
because
see.
the skin is pulled down. And
Okay.
so that is really the only treatment. As soon as somebody invents something, oh my God, they're going to make a fortune.
Billionaire.
So
Instant.
that's the story. The other thing about just having had a baby is,
10 months ago, I wouldn't get any surgery.
you know, it depends. Some people bounce back quickly and their skin tightens back up. Some people it takes at least a year for the looseness of pregnancy to
I waited
resolve.
18 months for my liposuction because I felt I had done everything in 18 months.
Right.
10 months, I wouldn't
Right.
do nothing, lady.
Okay, we got to wrap it up.
All right, well, that's another one of our exciting shows for you.
Thank you for listening.